Hello everyone. I wanted to talk about common rashes that we see in children, but that would take hours and hours. So I've decided to create a series of shorter videos starting with rashes that are caused by viruses. So today we're going to focus on chickenpox and shingles. So let's start off with chickenpox. It's caused by a virus called varicella zoster, and it is highly contagious and it's spread through respiratory particles. Its incubation period is about 10 to 21 days, which means that symptoms will arise 10 to 21 days after actual exposure. Now, symptoms usually start off with like fever and sore throat, so you think like you're getting a little cold, but within 24 hours, you'll start seeing a rash appearing. Now, the rash is pretty classical in that it shows up in what we call crops and stages. So the first rash that you'll start seeing is a group of papules, which are just small, firm bumps that you're going to see. Then that crop progresses into fluid-filled rash, and then that eventually goes into scabbed over. And so what you'll see is as one crop progresses, a new one will show up. So the classic sign is you see all three stages of the rash at one time. It usually starts off like in the torso or the central area of the body and goes out to the extremities and the face. Now, the rash is usually itchy and lasts about 2 to 3 weeks until all of it scabs over. Now, it is usually, chickenpox in general is usually mild in children with just supportive care for fever and itchiness. Now, please remember not to use aspirin for the fever, as the use of aspirin with certain viral infections is linked to what we call Reye's syndrome, which affects the liver. Now, some people can get complications of chickenpox, especially the susceptible population such as newborns or children with chronic diseases or immunocompromised children. And in that case, there are antiviral medications such as acyclovir that can be used to help with the disease progression. Complications include skin infection, pneumonia, encephalitis, and even hepatitis. Now, luckily, with the development of the vaccine, we have seen a drastic decline in the incidence of chickenpox overall. Okay, so now that you've had chickenpox, that virus, the varicella zoster virus, will lay dormant in your body and can reactivate later on in life, causing shingles. This usually happens when our body's immune system is a little weaker, such as getting older, having a chronic disease, or even an acute illness, or even just stress. Symptoms of shingles are usually going to start off with feeling a little feverish, tired, and having this tingling or burning sensation in a certain part of your body. And eventually, within a day or two, you're going to notice a fluid-filled, painful rash in that part of the body. Now, shingles is a concentrated rash that tracks along a nerve, so you'll see the rash is band-like. Now, shingles is contagious to those who have never had chickenpox, and it is only contagious through direct contact of the rash. Now, it will cause chickenpox, not shingles, in that other person. Now, antiviral medications can be used to shorten the course of the illness or decrease risks of complications. Complications include, again, skin infections, but it can also include involvement of the eyes and ears, especially if the rash is in that area, and also post-illness lingering pain. Now, remember, our best line of defense against both of these illnesses is vaccinations. We thank you for listening and see you next week.